Welcome back, everyone, to the Research Works podcast here at the EACD and the IAACD 2025 in Heidelberg. And right now, I have the absolute privilege of speaking to a keynote, Professor Thorsten Langer. Welcome to the podcast.
Oh, thank you. Happy to be here.
It's really nice to have you. We just were joking before. I'm not going to call you Professor throughout all of it, but I do think it's worthwhile making sure people know the breadth of the work that you have done. And sometimes the word professor just encapsulates that you've been in the area for a long time, experienced research.
Yeah, well, maybe.
Tell us a little bit about your work interests and what has brought you here to the conference.
Yeah, so I'd say I'm a child neurologist by training and a social pediatrician by heart. And so
that's a great way to describe
it. So we see patients with many neurological conditions and also neuromuscular conditions at the place where I work.
Yeah.
And in my research role, I'm doing health care research.
Yeah.
So we can draw many questions for our research from the experiences we make in doing the care work for patients and families. So that's a very nice combination. And so this here seems to be like the perfect place to present work, to learn about others' work, and to talk with each other.
More and more it's like that, isn't it? The more and more we work in the area, the more and more we realize we need everyone else. This is not something you can do on your own. And there's a lot of complexity there. And I love that, the title of your presentation was the International Perspectives on Transition of Youth with Duchenne Muscular Dystrophy. What is the transition for youth from child services to adult services look like?
Yeah. So I guess there are at least two important aspects to that. So one is the transition of care as a challenge for the organization of care. So patients need to find a provider in the adult system where they have been cared for in the pediatric system before. And there needs to be information, handover, and stuff like that. So there should be no disruptions. So that's one part.
Yeah.
The other part is that transition has also a lot to do with a psychological or emotional process of growing up. So it's about youth growing up, becoming more independent, autonomous, and also on the other hand, when you look at the family for caregivers, to leave room for youth and to let them have their own responsibility. So that's also an important part, so that transitioning of care also happens within the family. And in this particular group of patients affected by Duchenne muscular dystrophy, the second aspect is affected by the disease, because in that time when most youth become more independent, these patients become more dependent in terms of daily care, like with their body functions and stuff like that. So that makes it particularly challenging for them, but also from a research perspective, I found this is a really interesting area to look at.
Yeah. I love how you've separated that into the two, because it's important to understand what a transition of services looks like and what it means. And can we go to the perspective of the family? The point you made there was a really good point and an interesting point to make, is that for this population, getting older increases the need for more care, yet the desire to be as independent as possible. And for parents, they've been in a position where they've had to advocate and support their child. Letting go to an extent when they're getting older is hard. It's hard for any parent anyway. Can you talk more about that? Because I feel like that's such a tension point almost.
Yeah, there is this tension on the one hand, so which is also leads to quite complex issues. So, for example, we had one young man in our session this morning. He pre-recorded his his presentation, and he lives with a 24-hour assistance independently.
Wow,
So for this guy to live independently is quite another, even for a healthy, adolescent, it's quite a thing to move out and find an apartment and look that the refrigerator is not empty.
That's right.
But for this young man, it's quite a challenge to find the place where he can work, where he can get training, have his personal assistants. So he actually couldn't be here because there was no personal assistant available who could travel with him. So it's quite a challenge. So that's one thing. So this autonomy piece, and I think what is also what we need to keep in mind is that with these, especially with conditions like Duchenne, which are life-limiting, there are also these other topics that obviously affect their lives, like how long am I going to live? How do I make plans with this outlook? And so it's affected by the medical condition, but still it's the life. And so that's what we learned during this project, to really to think about what is the part the medical system actually has. So we cannot solve all the problems, but we have a limited role to play, which is important. But it's not everything. It's not everything about healthcare. But on the other hand, many of the life issues are affected by the condition. So it's it's a very interesting interplay between these different aspects.
So what is the role of healthcare? What is the role of medical professionals in the space?
Yeah. Well, I think it shouldn't be an obstacle. It should. I think from a patient's perspective, when we listen to the stories, we just should make it work better, to this transition of care, to have a pediatric care system and an adult care system, and the systems just have to talk together and work together. And that's not happening. And it's causing problems. And
why doesn't that happen? I mean, why do you think that happens? I mean, it's been an issue that's been around for a long time.
I think it depends a little bit, because in neuromuscular diseases, I think it's one aspect is that life expectancy has increased, especially with Duchenne. So it's not that long that those patients actually grow into adulthood that they need adult care providers. That's one aspect. And the second is that they have very complex care needs. So they need multiple specialists. And I think I just can imagine, but as I'm a pediatrician, but from an adult provider perspective, it's also a lot of work, to be honest, to take on a patient with a long history and a lot of needs. So it's also something which is usually not paid for extra. So that's also one part of the story. And then oftentimes it just needs good partnerships, and they need to be developed on a local level, probably. So I think there are several angles from which you could work the topic. So
what do you think an ideal system would look like? And have you seen one in action before?
We've seen some examples where aspects work pretty well. For example, sometimes there are joint clinics by a pediatric and an adult neurologist. So for the medical aspect and, handing over the medical history and having the patient present with both providers really supports this transition of that aspect of care. Others have, that happens in some places. Others have great support groups for families where they can work on these more life issues, as I would call them here. Like future and what am I going to do and what do you do? How do you cope with this situation? So I think this this is also something where oftentimes patient advocacy organizations can play a role.
Okay.
So I think there are aspects, but it's not on a systems level, I guess, and that's what we see in other conditions as well.
Sure. Driven by maybe a passionate group of individuals at a hospital that might drive that connection, but it won't be necessarily the case across the board. It's different.
Exactly.
What about from a timing perspective? When does the transition process start now? And ideally, is that too late, or should we be doing it earlier? Does timing have anything to do with it?
I think timing is a key issue, and there are different recommendations out there, and it also depends at what age patients need to leave the pediatric system. It's not the same in every country. For example, in Italy, we learned they can be cared for longer in the pediatric system, whereas in other countries it's 18, and then you have to, change. And also sometimes it's an issue for parents at an earlier stage than for the youth themselves. So parents might think much more about, how it's going to be like when in X years.
Yes.
Whereas for patients, when we did interviews with patients we included them, they are 12 or 13. And for them, the whole idea, they didn't really know what we are talking about.
Sure, okay.
So for them, it might be like 15. But at least I think what we could say definitely is you should consider it a process which takes like 2-3 years really to work with the issues and to reflect on what's coming and how you would like to organize things, because there are no easy solutions out there.
Yeah. I guess it sounds like, there's different needs at different times for parents, for providers, for the patient itself. So with all this work that you've done in this area to really identify this as something that we need to focus on, what's the next steps for you, your team, the work in this area?
So right now in the specific project I was able to work in, we are right now at the stage where we present our results to the patient communities.
Right.
During several town hall meetings, and just to get validate them or do memo checking, and also to draw ideas from there where we should go next. Because
great.
I think whatever you do, it's really important to do it together with different groups.
Yeah.
So it's you need to have several perspectives on board that to come up with meaningful interventions. And these could be developing models in certain areas, or and I think what we often heard is that you need a coordinator, like a go-to person who coordinates, but they need to be trained too, right?
Right.
So they need to learn about the conditions. So this could be something, or to work with patient organizations that they set up like platforms, but they might also need some input from the medical side or from the social services side to get all those information. So I think there are many ideas out there, and we need to prioritize with the people we're going to work with. Yeah.
And again, it comes down to, the common themes we hear throughout the conference. It's become stronger and stronger, it's developing partnerships and co-design. And, there's simple words for really big themes, really, and the amount of work it takes to bring everyone together. It is tricky because it's not just a person level, it's systems, it's policy, but it's significant, isn't it? Yeah. Well, thank you so very much for sharing your thoughts and the research in this area. It's certainly one that we haven't had many conversations about. This is, yet it's, when you talk to any parent, it always is on their mind, to the point where there is almost this great sense of uncertainty. And I think it's an area that's really important. So thank you for shedding light on it. Yeah. Well, to all the listeners, I hope you really enjoyed that. There's so much we can take from this. And look, it's a relevant issue for so many of the children, young adults that we work with. And yes, this was condition specific, but it runs for all of our children, really, doesn't it? Yeah. All right. We'll talk to you all again really soon. Bye.